Hey guys, so today we'll be doing another mock USMLE Step 1 and 2 question. So starting off with the patient presentation, you have Miss Smith. She's a 37-year-old female, presented in the clinic for severe right-sided facial pain. She states that she first noticed the pain about 6 months ago while brushing her teeth. Since that time, the pain has progressively increased in frequency. She states that when she does experience the pain, it's sharp and debilitating, but it only lasts for a few minutes at a time. Physical and neurological examination is otherwise unremarkable. What is the next step for the management of this patient? And so the options are for this patient: do you want to do surgery, give carbamazepine, give botulinum toxin A injections, or give sumatriptans? If you need more time, you can take a second and go ahead and think and pause the video. The correct answer is carbamazepine. So let's go through this entire question and go over why that's the correct answer. So the first thing you have to know about this patient is they're presenting with trigeminal neuralgia. Their entire clinical presentation is very consistent with that. And in general, patients with trigeminal neuralgia will report these severe, brief episodes of sharp, shock-like pain, and it's in the distribution of trigeminal nerve. The pain typically lasts less than 2 minutes, but in some cases it can last longer than that. But the vast majority of the patients, it will be less than 2 minutes. And for most patients, the pain will be unilateral. And interestingly enough, so within the trigeminal nerve, you have three branches: ophthalmic, maxillary, and mandibular. For the vast majority of patients with trigeminal neuralgia, around 95% of patients, the pain will be in the maxillary and mandibular divisions. And for patients with trigeminal neuralgia, the first line treatment is carbamazepine. That's why, going back to your question, that is the correct answer. So once again, just hammer that into your head. The first line treatment for trigeminal neuralgia is carbamazepine. Another option, choice A, was surgery. The reason that's the incorrect answer for this case is that the first line treatment is carbamazepine. For patients where carbamazepine is ineffective, you can go ahead and do surgery, but that's a second line treatment. Another option I put in our question was botulinum toxin A, which was option C. And so there's some early studies which have shown promising results with this treatment, but once again, that's neither the first or second line treatment for trigeminal neuralgia. And the last option was sumatriptans. Triptans, for the most part, are used for the treatment of migraines and don't have any role in the treatment of trigeminal neuralgia. So the overarching thing that you should remember from this question is remember what the clinical symptoms for trigeminal neuralgia are, which are short, severe bursts of pain that last a couple of minutes. And the first line treatment is carbamazepine, and the second line treatment is surgery.